Obesity and ovarian cancer. The American Institute for Cancer Research and World Cancer Research has a new study out today, and here are those highlights. The report lists obesity as a probable cause of ovarian cancer, and for the first time, it suggests being overweight increases your risk of this type of cancer. Researchers note the increase is modest, so here's the thing. A 5% increase in a woman's body mass index, or your BMI, that could increase your risk of ovarian cancer by 6%. We are joined by Dr. Dale Fuller, an oncologist at Texas Oncology at Medical City. Thank you so much. So the bigger we are, the worse off we are when it comes to cancers, really in general.
The heavier we are. The calculations assume both height and weight, and so you can have tall, thin people.
But can we really pinpoint exactly what it is? Is the research saying it's a hormone, it's this or that is because you're fat, it affects your ovaries?
You really can't. But you can say with a high level of certainty that people who are heavy are going to have more problems with ovarian cancer, uterine cancer, for males, cancer of the bladder and the prostate, for both genders, pancreas cancer, and certain other abdominal malignancies in the intestinal tract. So it doesn't pay to be fat.
And it's harder to treat ovarian cancer if you're overweight. Why is that?
In my line of work, which is radiation, I've got to get down where the ovaries are, and the more tissue that I've got to get through with a beam of radiation to reach the ovaries, the more the patient is getting in terms of what we call
heavy doses.
Yeah, and that leads to problems. So,
okay, and one of the most interesting things I think you said earlier was that you can reduce your risk down to 0 if you lose the weight and get below the...
Well, that's not really an absolute, but it's certainly less likely if you're of normal weight and normal height or average height that you're going to be a setup for getting a cancer.
Okay.
It's not 0 by any means, but it's better.
A lot better. Okay. Yeah. Well, thank you, Dr. Fuller. We appreciate your time.
It's my pleasure.
Thanks for coming in.